Hi, I'm Dr. Choate.
I'm Dr. Miller.
Salutations, I'm Dr. Dixon. Hello, today our patient is Louise Parker, who is a 65-year-old woman and she's suffering from kidney failure. She was a healthy and active woman besides having high blood pressure, and she also has an intellectual disability. Her sister, who always served as her decision maker, now has dementia and is unable to give consent. A decision must be made as soon as possible whether we should give her or put her on dialysis or not, because her glomerular filtration rate is 17 and a rate of 15 is deadly. People with kidney failure can survive days to weeks without dialysis, but in Louise's case, it may be sooner due to her high blood pressure. She must be sedated for dialysis. If she were to receive the treatment of dialysis, she must be sedated. Her staff say they have no idea what to do, but another guardian says not to worry about Louise having to be sedated for dialysis because the guardian represents 3 others who have conditions similar to Louise, and they are fine on dialysis. She would receive dialysis in either a hospital or an assisted living center.
Reasons not to consent to kidney dialysis is because she has very severe kidney failure and she would need to do it 6 to 7 times a week for 4 hours at a time, and during this time she would also have to be sedated, so then she would be groggy afterwards for a little bit longer. If she decided to do a kidney transplant, she would be low on the list because she has a mental illness and they would want to give the kidneys to healthier, younger people. And then the kidney transplant would also be very expensive for her, and she would have to go on a special diet and limit her liquid intake. She would also have to be on this dialysis for the rest of her life. The side effects of dialysis she would have to live with every day, and these side effects include cramps, sleep problems, anemia, bone diseases, dry or itchy skin, and more.
The reasons we have to consent to dialysis for Mrs. Parker is once again that the other guardian said that it can be done with her patients being sedated more than 1 time a week. There's always a possibility she will receive a kidney donation because we put her on the transplant list, so she can always get set up for that. Without the kidney dialysis, she will die because her kidneys will fail. But we also found an opportunity for her to do nocturnal dialysis, which is receiving dialysis overnight, so while you sleep, which is a longer, but it's gentler, and it'll take about 6 to 8 hours, so we can sedate her for the night so she'd be able to get her sleep. And it'll clean her blood and filter her blood the same way normal dialysis would. And if we notice that the side effects are too hard for her or she's struggling at all, we can always reverse our consent and take her off the dialysis. And this will give her a chance to live. So this was our final decision. We did decide to give her the kidney dialysis because everyone deserves a chance to live.